Welcome to today's session. Today we will be diving into key practical and viva topics in hematology. We will cover blood sample collection questions, microscopy, hemocytometry, RBC, WBC, BTCT and more, each with clinical relevance. So let us start by discussing blood collection questions. So the usual question we expect is which blood is generally used in hematological practical and why. So the answer is capillary blood because it is easy to obtain, less invasive, causes less pain and can be collected at the bedside ensuring patient comfort. And why middle three fingers are preferred for skin puncture? Why not thumb and little finger? So when performing a skin puncture, the middle three fingers are always preferred because they have most fleshy pads and it has a better blood flow compared to the thumb and little finger, and also it is easy to collect the blood sample with less discomfort for the patient. Thumb and little fingers are not preferred because the underlying palmar fascia of these digits of thumb and little finger extend up to forearm. So in case of any infection at the site of injury, there is a chance of infection to spread to the forearm. Which is the ideal site for collecting blood in newborn and infant? The answer is heel and plantar surface of the big toe. So what are the important precautions for finger prick is you have to say about using a sterile lancet, avoid squeezing the finger, collecting the blood promptly. So all other precautions you have to say while pricking the finger. Along with that, you should say why it should not be squeezed, because never squeeze the prick finger because squeezing can mix tissue fluid with blood, diluting it and giving inaccurate result. So next we are moving to the microscopy and hemocytometry viva questions. So what are the adjustments of light intensity for different power objective lens? This is a question you are going to face about the microscope. So first thing is this color may differ with some microscope. So standard is like this one. So if the objective is 4x, you have to remember that intensity of the light should be at the lowest. Okay, intensity of the light should be at the lowest, and you have to remember the diaphragm is slightly open and the position of the condenser should be lowest. So if it is 4x, then the intensity of the light should be lowest, diaphragm should be slightly open and position of the condenser should be at the lowest. And if it is 10x, then that is low power, then the intensity of the light is low and the diaphragm again slightly open and the position of the condenser should be lowest. If you are using 40x high power for RBC especially, this 10x we use for WBC counting. In this 40x, the intensity of the light is like medium and diaphragm is half open and the position of the condenser is at the highest. If we are using oil immersion technique 100x, especially for DLC counting, then the intensity of the light is highest and diaphragm is completely open and the position of the condenser is highest. This is the adjustment of light intensity for different power objective lens that we are using. So how do you differentiate between RBC pipette and WBC pipette? That's the most important question you can expect during your viva. So RBC pipette, it has a red mouthpiece. The mouthpiece is red, okay, and the bead inside the bulb is red, and you can see the diameter of the bulb is broader compared to the WBC, whereas the graduation is still 101. WBC, it is 11 and it has a narrow bulb compared to RBC, and then the mouthpiece color is white and the bead color is also white. So these are the important differentiating features between RBC pipette and WBC pipette. So now the usual question that you can expect is what is parafocusing? Okay, parafocusing means the microscope remain in the focus when the objectives are changed. Okay, so it is one of the property of microscope where the focus remains relatively constant when changing the objective. That means the microscope remains in the focus when the objectives are changed. So what is the area of one rule platform of new bar chamber? Okay, the area is 9 millimeter square. New bar chamber, one rule platform is 9 millimeter square. So what are the functions of the bulb in the dilating pipette? So the bulb and bead inside the pipette help mix the blood with diluting fluid, and also it helps to identify the pipette, and also it helps to identify whether the pipette is wet or dry. So three purposes it has. One is to identify whether it is a WBC pipette or RBC pipette. So inside the bead, if it is red, it is RBC pipette. If it is white, it is WBC pipette. And we can ensure that whether the bulb is, whether the pipette is dry or wet. Okay, if the bead is like freely moving, which means the pipette is dry. If it is sticking to one part, which means it is wet. Okay, and then it helps to mix the blood with the diluting fluid. So what are the functions of beads? That's what I have explained now. Why it is important to discard the first 2 drops of diluted blood from the pipette before charging the counting chamber. So the stem of the pipette contains only cell-free diluent. Okay, so in the pipette, if you you're likely to withdraw 0.5 blood till 0.5, right? After that, you will be withdrawing, that is you are sucking fluid, either WBC fluid or RBC fluid. So when you are sucking in, the point till here in the stem of the pipette, you will be having only that dilute, which means you will be either having RBC fluid or WBC fluid. So this contains no blood. So it should be discarded before charging the chamber. Otherwise the count will be very low and erroneous. What is ideal charging, overcharging and undercharging? This is the usual question we can expect during hematology practical Viva, especially when you are doing RBC and WBC counts. Okay, so ideal charging is the chamber is completely filled without any excess fluid spilling into the grooves or gutters. So this is a groove, right? H-shaped groove. So the chamber is, this is the chamber. So the chamber is completely filled without any excess in the sense, this is a groove. Any excess fluid spilling into the groove or gutters. So overcharging is chamber is added with too much of sample, so causing the fluid to overflow. You can see easily, you can see in the gutters it is filled with the fluid. Undercharging, the chamber is not adequately filled. So the chamber, if only this area you have charged it, and this area remains empty space. Okay, so which means you are actually counting wrongly and it is going to produce the error. Precautions for pipetting, yes, we have to use a dry pipette first, and gentle suction is needed without air bubbles, and draw blood exactly till the appropriate mark, no upper than like 0.5 or no lower than. So now we are moving into hemoglobin practical. So first question you can expect is name the different types of normal hemoglobin. Normal hemoglobin you have to know, or types of hemoglobin. So here you can know that we have adult hemoglobin, fetal hemoglobin, embryonic hemoglobin. So adult hemoglobin is alpha to beta 2, that is hemoglobin A, and we have hemoglobin A to alpha to delta 2. So 2 alpha chains, 2 beta chains, and this one 2 alpha chains and 2 delta chains. These are normal adult hemoglobin. And normal fetal hemoglobin is alpha to gamma 2 chains, HbF. Embryonic hemoglobin, we have Gover 1 and Gover 2. So 2 zeta chain and 2 epsilon chain. And Gover 2 has 2 alpha chain and 2 epsilon chain. Okay, 2 alpha chain. and 2 epsilon chain. So these are the normal hemoglobin types you have to answer. What are the abnormal hemoglobin? So you have to say like hemoglobin S, that is sickle cell, okay. And then hemoglobin S, sulfhemoglobin, methemoglobin types, and obviously you have to answer the normal hemoglobin value. When you are answering for the normal hemoglobin value, you have to divide to male and female. If you are comfortable, you can go with this newborn and pregnant women also. Okay, for adult male it is 13 to 17 gram per deciliter, and adult female 12 to 15, newborn 16 to 22, and pregnant women it is 11 to 14 gram per deciliter. Always say with units. Many students forget to say the unit. They just say the number. It is not at all acceptable. You have to say with the unit. And the methods for estimating hemoglobin, because obviously in all the practical you will be using Sally's hemoglobinometer, okay, but other methods are also there, like acid hematine method you are following as a usual practical. Other visual methods are Hayden's method, Halden's method, Dave's method, and Winthrop's method. And we do have spectrophotometric methods like oxyhemoglobin method and cyan hemoglobin method. And if they ask which one is the most accurate method, you have to give the answer is cyan hemoglobin method. And then the procedure you are going to do is Sally's. So definitely they will be asking advantages and disadvantages of Sally's method. So Sally's method advantages, it is very easy to perform, very convenient to perform, and it is like not time consuming. Okay, even it can be performed in the remote areas. The reagents, apparatus are very cheap and are easily available, and least technical expertise is required, because with half an hour of demo you can easily start doing the Sally's hemoglobin method, that is acid hematine method. Another disadvantages of Sally's method are like it is a visual method, right? So we have a more chance of error. I may say the color comparison in one way, or you may see in different way. So it is subjective. So there is more chance of error. All hemoglobins are not converted to acid hematine here. That you have to know. This is the main point. All hemoglobin in the sense all types of hemoglobins. It may be normal or abnormal, whatever it is, okay. We cannot convert all types of hemoglobin into the acid hematine. And the quality of light, yes, obviously affect the final observation. It should be usually done in daylight. If you are inside the lab, there is no possibility of daylight, artificial light is there, then that is definitely going to affect your final observation. And yes, of course, the individual variation in matching of color. Why we have to wait 10 minutes? Hemoglobin to be converted into acid hematine, for that we have to wait for 10 minutes. So within 10 minutes, there is a possibility like 99% of the hemoglobin is converted into acid hematine. And then how do you calculate oxygen carrying capacity of hemoglobin? Okay, so 1 gram of hemoglobin carries 1.3 ml of oxygen. You have to remember this. 1 gram of hemoglobin carries 1.34 ml of oxygen. So oxygen carrying capacity is equal to concentration of hemoglobin in gram per deciliter into this value, 1.34 ml oxygen gram per gram hemoglobin. Why should the stirrer be kept above the solution but not taken out of the tube while matching the color? This is the main thing you have to remember while doing the procedure also. You should not take the stirrer out of the solution. Why? Because if you take it out, the solution appears different. So if the stirrer is left in the solution will appear light. So solution appears light. If you take it out, you may see the different color. If you kept in, you will see the different color. Many students do this mistake during their practical. They usually keep it inside and then they will compare the color, which means if it is left in the solution, it appears lighter. Obviously it is going to give the wrong value of hemoglobin. So always take the stirrer up but not out. Okay, so if this is your hemoglobinometer, if here till here your solution is, you should take it up but not out of the tube. And also if you take it out, there may be a solution loss. Removing a stirrer completely from the tube can lead to solution loss. That also you have to remember, which means you are going to have a wrong value. So moving on to the RBC. How will you identify RBC pipette? Obviously, we have discussed this, but still, this is the RBC pipette. You know very well. The mouthpiece is red in color. The bulb is broader and it contains red color bead inside, and the marking is till 101. That you have to remember. Other uses of RBC pipette, yes, it is RBC is used also for counting the platelets and also for counting WBC in case of leukemia. In leukemia, we have increased WBC count, right? So we cannot use a WBC pipette to count it. So you are using RBC pipette to count for the WBC in case of leukemia also. This is a very, very important question. Okay, the other uses of RBC pipette. Name the RBC dilating fluid. So we use Hems fluid. So the composition of Hems fluid, obviously you have to say about this. If you are not able to say this composition, or you should remember the constituents, and then we will be expecting you to say the function. Okay, so if you are not able to remember the function, then at least try to say the constituents. Okay, I recommend you to remember the constituents along with the function, so to score a good Viva mark. So we have to remember sodium sulfate is there, prevent RBC from aggregating. Sodium chloride 0.5 gram, it maintains osmolarity and isotonicity. Mercury chloride, it acts as a preservative, prevents contamination by microorganism. Obviously distilled water 100 ml as a solvent. So Hems fluid contains sodium sulfate, sodium chloride, mercury chloride, and then distilled water along with the respective function you have to remember. So what is the normal RBC value? So RBC value, again you have to say by gender. So adult male 5 to 5 million per millimeter cube of blood. Always say with the unit, never forget the unit. For adult female it is 4 to 4.5 million per millimeter cube of blood, and for newborn it is 6 to 8 millions per millimeter cube of blood. Why RBC count is higher in male compared to female? So many students give answer as menstrual cycle. You should not give answer as menstrual cycle for this question. What you have to talk is, you have to talk in relation with hormones. Males, we have testosterone. Testosterone stimulate erythropoiesis, and estrogen in female inhibits erythropoiesis. This answer will be expecting most important question when you are doing this RBC. So again, obviously the secondary question, if you are doing your Viva in a good way, then we'll be moving to these type of question like define anemia or name any condition where RBC is decreased. When you say anemia, we'll be moving on with the questions like define anemia, what are the classification of anemia, most commonest type of anemia in India, that is iron deficiency anemia, you have to say, along with the signs and symptoms of anemia. So moving on to variations. So variation in the sense either it should be increased or decreased. So increased RBC count physiologically we can expect in case of high altitude, in newborns and excessive sweating, and pathologically when you are losing the fluid like vomiting, diarrhea, and also in case of congestive heart failure, polycythemia vera, the RBC count is usually increased. At least name 1 or 2 conditions. Remember 1 or 2 conditions, pathologically and also physiologically. Decreased RBC count is in case of pregnancy and women. Obviously we have a decreased count of RBC due to estrogen. Okay, estrogen that inhibits the erythropoiesis. Pathologically anemia and also excess antidiuretic hormone secretion in case of pituitary tumor, that you have to remember. So what are different RBC indices? Okay, RBC indices, we know that we have mean corpuscular volume. Mean corpuscular means, this is corpuscular means cell, right? So mean cell volume means average size of the RBC. Mean corpuscular hemoglobin, so average weight of the hemoglobin in RBC. Okay, so again mean corpuscular hemoglobin concentration, which means average concentration of hemoglobin in RBC. So volume talks about average size of RBCs. So hemoglobin, MCH, okay, hemoglobin talks about average weight of hemoglobin in RBC. Mean corpuscular hemoglobin concentration talks about average concentration of hemoglobin in RBC. So then moving on to WBC procedure. How will you identify WBC pipette? So universal question like white mouthpiece. Okay. And then this bulb, if you see, it is narrower and there is a white bead inside the bulb and the markings up to 11. So name WBC dilating fluid as Turk's fluid. The composition of the Turk's fluid is glacial acid, which is for destructing the membrane, gentian violet or aqueous methylene blue for staining the nuclei of WBC, and then distilled water that acts as a solvent. So variation, leukocytosis. We ask the question, what is leukocytosis? You have to say increased WBC count. So physiologically, what are all the physiologically where you will need note the WBC increase. Pathologically, what are all the condition? You will see WBC is increased. So physiologically, newborns, obviously in physical exercise, during physical exercise, after food, pregnancy and parturition, at least two conditions physiologically you can remember. And pathologically, acute and chronic bacterial infection. Acute and chronic bacterial infection you have to say. And also tissue injury like burns where there is a loss of plasma. And also inflammatory disorders and viral infections. Leukocytopenia. Leukocytopenia has decreased WBC. Leukocytopenia. Okay. So physiologically it is very rare, and pathologically you can see typhoid, paratyphoid fever, early phase of viral infections, severe sepsis, aplastic anemia and cytotoxic therapy. So moving on to bleeding time and clotting time. So define bleeding time. Yes, we'll be asking this question. The time from the start to stoppage of bleeding. Stoppage of bleeding from a small standard wound. Okay. So you are going to prick it, right? So it is a small standard wound. So you can define the bleeding time as the time from the start to stoppage of bleeding from a standard small wound. So the method we use usually in the physiological lab is like Duke's method. Okay, and the normal BT by Duke method is 1 to 4 minutes, and the clotting time, the time between the start of bleeding till formation of fibrin thread. Okay, so here in bleeding time, the component of blood you check is usually platelets. Okay, but here in clotting time, the component you check is clotting factor. This you have to know, the difference between bleeding time and clotting time. And then the method we use for determining the clotting time is capillary method, and the normal CT by capillary method is 3 to 8 minutes. And here you can see the CT is more than BT, right? So this is like 1 to 4 minutes and clotting time is 3 to 8 minutes. Why CT is more than BT? Okay, so bleeding time is a time from the onset of bleeding to stoppage of bleeding, right? Onset to stoppage of bleeding. Bleeding stops due to formation of temporary hemostatic plug, that you have to say. Whereas clotting time is a time taken from the onset of bleeding to formation of secondary hemostatic blood, right? That is secondary means definitive clot, hemostatic plug. So this is the onset of bleeding to stoppage of bleeding, that is temporary hemostatic plug. Whereas CT is onset of bleeding to formation of fibrin thread, that is clot. So that's why CT is more than BT. So temporary hemostatic plug occurs earlier because it is the primary or temporary than the definitive clot. And you will be asked about name the condition where bleeding time is prolonged. So you can see any one condition like thrombocytopenic purpura, the most important answer we will be expecting from you. Or you can go with aspirin overdose, vascular diseases, scurvy and dengue also. And name any condition where CT is prolonged. So you can go with clotting factor deficiency, deficiency of vitamin K, liver disorders, anticoagulant overdose. Any two conditions you can see. So this bleeding time and this clotting time both is increased in case of DIC, disseminated intravascular coagulation. So I think that covers the essential practical and viva topics in hematology. Okay, each point is like clinically important and relevant to everyday medical practice. So please review these concepts carefully. Because they form the basis for many lab procedures and help to correlate clinical findings with the lab values also. These are the basic questions you will be expecting during your hematology practical. Okay, all the best for your exam. Thank you.